Hi friends, welcome to this crack nursing licensure exam. So today in this video we are going to discuss the next topic with the test taking strategies. So the previous class, the previous video I have discussed regarding the test plan, how the question answers will be taken up for the Prometric exam, even mainly for the NCLEX exam. So even further, there are few more test taking strategies are being followed whenever the question answers are being framed, they will be following these strategies only. So there are few key test taking strategies are there. So among this, we are going to see the few points now. So in the next video, I will be discussing you the remaining topics, remaining list of strategies. So the first one is the pyramid point, then ingredient of a question, then strategic word, subject of the question, then positive and negative event query, and using of ABC and using of Maslow's hierarchy needs and nursing process, determining abnormality exists, client needs, eliminating comparable and alike options, eliminate options with the closed-ended questions, look for the umbrella option, and use guideline for delegating and assignment making and answering pharmacological questions. One by one, we are going to discuss each strategies. The first one is the pyramid point. Pyramid point, that is usually said like a pyramid. You can keep a example like a pyramid. Usually a pyramid has a three-ended point, no? So when we are looking at each point, one point will be at the topmost. So among the four options which is being given in the questions, one option will be the topmost. That will be the priority. The first one you will be doing it at the first step. So what is that? You have to find out with these questions type. So that is the first strategy they will be using. So example, I will be discussing with the example so that you can understand more easier. The nurse is caring for the hospitalized client with a diagnosis of heart failure who suddenly complains of shortness of breath and dyspnea. The nurse should take which immediate action to take care of this patient who is having a complaint of shortness of breath and dyspnea. What is the immediate action you will be doing here? They are asking you. First option, they have given administer oxygen to the client. Second option, prepare to administer furosemide. Third option, elevate the head of the client's bed. Fourth option, call the doctor. Which is the first priority action you will be doing it here? Immediately, you first look at the patient with this complaint. First, we must ensure the patient's position first in this condition. So, the correct answer, we need to elevate the head of the bed. Whenever you are seeing the patients with the heart failure, they are getting affected with their heart. The cardiac output will be very less. They are more. They will be struggling to give out their cardiac output to meet the demand of their body through the way of blood supply. As oxygenation has also been getting, delivery also will be delayed here because of this decreased blood flow. Decreased in their cardiac output. That is the main problem which is being characterized here with this heart failure. So immediately, as you see the patient, first we must elevate the head end of the bed. Once you receive the patient also, first you make the positioning like this. Then after that you can go with administering the oxygen. Even you can go with the administration of the furosemide. If you want to get a doctor's prescription before giving the medication, you can have the third option as calling the doctor. Then you can go with the furosemide after they have prescribed you. Okay, so this is the first strategy. The next strategy is the ingredients of the question. So you must look at they will be framing the questions based upon each type of ingredients. That means subject you can say. So one of the example here is the nurse is caring for the client with a terminal cancer, and what is the event query with this event means the nurse should consider which factor when planning the opioid pain relief. What is the factor you can consider here when you make a planning with the opioid pain relief? So when we have been planning this pain relief for the terminal cancer cases, because this condition with the terminal cancer, that is not a curable one. Anyway, they will be end up with this cancerous condition till the end of their death. So they have to go with this cancerous condition till the end of their death. So in this time, with this opioid pain relief management, we have to plan according to it, based upon their complaints that has been arising within them. So as a first option, not all pain is real. Opioid strategies are highly addictive. Opioid analgesics can cause a tachycardia. Around the clock dosing gives better pain relief than as needed dosing. So among this, we have to go with the consideration with the conditions. That is a terminal cancer condition. So with this terminal cancer condition, the pain will not be subsided with the single dose of painkiller, but the pain will be continuous again and again. It will be controlled. Then again, after the action of the drug has been weared off, again the pain will be continuous. So this will be continuing throughout their conditions and throughout their lifetime. So that is a terminal cancer's characteristic. So to manage this, we need to go with the around the clock dosing method is the correct method to be followed. So the fourth option is the correct answer. So this is like a end stage cancer. So around the clock dosing, that will be gives a better pain relief for them with this opioid drug. So that is the correct option to be mentioned. The next strategy is that some of the words will be used based upon the needs. They will be using some of the words in making their questions. So how to prioritize? That means while they are asking the needs to prioritize the question, they can ask you in a different words like best, which is the early, late, essential, first, highest priority, immediate, initial, most appropriate, most important, most likely, next, primary, viral, and these are all the words which is being used to prioritize. To make a prioritization, they can use like this in different words. As a words that reflect assessment, they can use some more words also. If they are asking you with a assessment basis question, they can frame a question with the words like ascertain, assess, check, collect, determine, find out, gather, identify, monitor, observe, obtain information, and recognize. So like this way, the different words are being used here as a keys to make a questions. So for each and every needs and with a prioritizing or even like a assessment basis. Now we are going to see one more question example. The nurse is caring for the client who just returned from the recovery room after undergoing abdominal surgery. The nurse should monitor for which yearly sign as a hypovolemic shock. For the hypovolemic shock, which would be the yearly sign you can see with the patient in this post-operative time. Here the patient already is been coming out with the after the surgery, abdominal surgery, and he is been returning from the recovery room in the post-operative time. What would be the yearly sign you can see here as a hypovolemic shock? Sleepiness, increased in pulse rate, increased depth of respiration, increased orientation to the surroundings. Whenever the hypovolemic shock occurs, that is because of a bleeding, because abdominal surgery, that is like a vast area with the abdominal cavity. When you make a open surgery, like blood loss happens easily. So the hypovolemic shock is the more risk to have. The patients, those who have been undergoing the abdominal surgery, are more risk to have this type of hypovolemic shock because of this excess blood loss happens there. So as a symptoms during the time of post-operative time, the patient will show the symptoms with the blood loss like BP variation and pulse variation. That is the immediate vital signs you can see here. So the first option, they have given sleepiness. Usually because of the anesthetic effect they will be like in a sleepy only already. So you can't take that option as your correct answer. But the initial vital signs, the basic vital signs that you have to identify with the shock, with the over bleeding, like blood loss, you have to check first as a pulse, then you have to check the BP. So the correct answer is the increased in pulse, you will be getting tachycardia. So what is the hypovolemic shock? Actually, because of this over blood loss, with the hypovolemia, they will be undergoing hypovolemia initially, where the following that venous return also decreases here. So along with this, the preload also will be decreases. Following with that, cardiac output also will be lowered, and following that, hypotension occurs, where the BP will be getting lowered. And as the BP, as the blood pressure, as the blood flow to the each and every organs are being getting lowered, the finally the perfusion is also getting failure to them, and even tissues also in their particular organ will be getting hypoxia, decreased oxygenation. And following that, if it is not even in this time also, if you are not intervening that condition, means the following that the organ damages occurs and organ failure will be followed up. So the finally the every organs will be getting a multi-organ failure. The resultant will be like a multi-organ failure. With each and every organs will be getting failure because of this decreased blood flow and hypoxemia. So the correct answer with this question is the increased pulse rate will be there. So we need to check for the tachycardia. That is the thing initially we will be doing it. So when we are going with the hypovolemic shock, as a system wise, the central nervous system, like early shock, they will be having the mental status alterations will be there, and with the cardiac, the first initial thing tachycardia, then the orthostatic hypertension, as I told you already. Even with the renal system also, like oliguria, anuria, respiratory, tachypnea. With the hepatic there won't be any change, but with the gastrointestinal also no change. Even in the hematological also, even they can have anemia because of that blood loss following with that, and metabolic also nothing you can see. But in the later stages you can see many things with each and every system wise. Mainly with the cardiac you can see cardiac failure occurs, and with the arrhythmias and with the hypertension. Following with that renal, like anuria, and with the respiratory tachypnea and respiratory failure, and with the hepatic liver failure, and even with the GI system also, like mucosal bleedings, and with the hepatological coagulopathy, and with the metabolic acidosis and hypercalcium and hypermagnesium. Like this way, the changes occurs in the later signs also. As a later signs you can see in all the systems. So the basic thing, initially when the blood loss happens, we need to go with the increased, we need to check their heart rate, that's the pulse rate, that will be getting increased up, tachycardia, then following with that hypotension. The next strategy is the strategy of the word we are going to see. That is the subject of the question. So there may be a specific topic they will be choosing there to ask you a question. They will be framing a question for it. Example, with that each and every examples you can able to understand those strategies easily. That's why I am showing you the questions related with it each. One of the example is the nurse is teaching a client in a skeletal leg traction about the measures to increase the bed mobility. You may be seeing the patient who are being under a skeletal leg traction. Whenever the patient is being under a skeletal leg traction, the patient mobility will not be possible there. So to improve the bed mobility, that means even though they are being under the traction, to make their mobility with their upper body trunk areas, even with their buttock and with their upper body trunk, with their back, to make a mobilization, which is the most important thing that will be helpful here. They are asking here as 4 options they have given you: television, fracture bedpan, overhead trapeze, and reading materials. Among these 4, which would be very helpful for them when they are being like in a bedridden, to make them to have the increase in their mobility with the under their traction. That is mean they are under a skeletal leg traction. So I will show the picture here. So the correct answer is the overhead trapeze. You can analyze the answer here. So when you see the patient under a skeletal leg traction, you can see the patient like this. When you have been the patient is been under the traction. So like this way, the pulleys and all the ropes and the leg end also will be raised like this, with the support, with the weight also will be hanging on their leg end, with the pulleys that will be pulling the pressure also, towards that part. So like this way the assistant, like this way the patient will be lying. So during this time, as to make a bed mobility, which would be the correct one? As I told you with the previous slide, I will show the options again. Television, fracture bedpan, overhead trapeze and reading materials. Then the other three, the overhead trapeze, what is that overhead trapeze means? We can see, which has been hanging over the head of the patient. That is like a triangle shape. That is called as a trapeze, which has been extremely helpful in assisting the clients to move about in a bed, even to get off on and off the bedpan. For that purposes also this trapeze will be helpful. By holding that in their hands, in their arm, through their with the help of their trapeze, they can hold it and they can move it from side to side. So that's a helpful thing that is being needed here in this condition, in this subject. So in this skeletal leg traction. So this is a correct answer. Overhead trapeze is the correct answer. So next, from the positive event query. What is a positive event query? What is the positive event query means? That is a patient understanding capability. How he understood well regarding the instructions which is being given by the nurses, the doctors regarding the procedure, how he understood and how he is been getting instructions from the nurses and how he is following it, whether it is in a positive way or in a negative way. So there are two things. They can ask you in the based upon positive event query and even the negative event query also. The positive event query, they can ask you regarding the patient's understanding capability as a positive, in a positive way. Example, I will show an example, you can understand better. The nurse provides a medication to a client about the dejoction, which is statement by the client indicates an understanding of its adverse effect they have asked you. So based upon the 4 statement which is being stated by the patient, you can able to say that patient is understanding well regarding the adverse effect of the dejoction drug, which is the correct statement. You need to identify. This is called as a positive event query. First one, he is saying blurred vision is expected. If I am nauseating or vomiting, I should stay on liquids and take some liquid antacids. This medication may cause a headache and weakness, but that is nothing to worry about. If my pulse rate drops below 60 beats per minute, I should let my doctors to know. Which is the most important adverse effect, you have to note it down. You may be taught already to the patient regarding the dejoction's adverse effect and side effects. So here the very important one thing is that it will be controlling their heart rate, pulse rate. So that will be controlled. Even though if the dejoction is being taken continuously for a prolonged days, you need to check their pulse rate often in between the treatment, because that will be if it is been lowering more, if the effect of the dejoction happens more, the pulse rate can drops towards the bradycardia. So we need to check for that adverse effect. So the proper understanding with this question which has been showing the patient has been understood well with the 4th option. If my pulse rate is been drops below 60 beats per minute, I should let my doctors to know. That is the correct answer. So what is the main function of the dejoction? That usually increases the contractility of the heart and which will be helpful in slowing the conduction velocity also. And which is used in the congestive heart failure, those who are having with the atrial fibrillation with the refractory heart failure. And if any toxicity happens with this dejoction, in this question I have discussed that is a bradycardia occurs. That is usually the immediate adverse effect you can see with this drug usages if it becomes over usages. If it happens like a toxicity, hyperkalemia, arrhythmias, heart block, even hypokalemia, hypomagnesemia, hypercalcemia, all those things you can see with the toxicities. So next question is the negative event query. As opposite to the positive event query, you can understand here with the negative event query, which statement and which thing that shows that patient is not understood well. That means he is not understood properly regarding your instruction, regarding your information, regarding the procedure. He is not understood. Which statement that is been indicating that the patient is not understood. So as an example, the nurse has reinforced discharge instruction to a client who has undergone a right mastectomy with the axillary lymph node dissection. Which statement by the client indicates the need for further teaching regarding home care measures. Here one of a woman is been getting a right mastectomy along with the axillary lymph node dissection also, and he is getting discharged after the procedure. He is going home. As a discharge instruction, you are already instructed them regarding the home care also. And after getting all those informations from you, she is being stated one of the thing that is not appropriate to the home care measures. That is not a correct way to take care of them in the home. Which is that? You have to find it out. That shows that patient is being stating a wrong one, which should not be done after the surgery during the post-operative time. First option, I should use a straight razor to shave under my arms. I need to be sure that I do not have blood pressures or blood drawn from my right arm. I should inform all of my healthcare providers that I have had this surgical procedure. I need to be sure to wear a thick mat hand covers or use thick thick pot holders when I am cooking and touching a hot pan. Which is that statement we need to identify. She is saying that I should use a straight razor. Whether it is a correct, we should not use it like that to shave the under her arms on that particular side. So that is a wrong one. But with the second option, I should not have BP. Yes, it's true. You should not take a BP on that particular hand side. And even if there is any problem happens, they should inform their doctors immediately. And even if they go for any other doctor's consultation also, they have to inform them that previously she was been undergone this surgery. And even the fourth option, she should use the proper thick mat hand covers whenever she is been handling any kitchen hot pot and with the cooking utensils whenever she is been touching the hot pans. So that is also a correct way to follow. But the first option is the wrong one. That shows that she is not understood properly regarding your instruction which has been said after the surgery. So that answer is I should use a straight razor to shave under my arms. That should not be done. After going with the surgery, they should not use like that. So as a risk of mastectomy, what are all the things that can happen here? Bleeding will be there. Infection is there. Pain will be more. Swelling happens because the lymph node also will be getting removed here. So as a removal surgery, there will be a formation of edematous, you can see in the lymph edema, and formation of the hard scar tissue also at the injection, like at the surgical site, and shoulder pain and stiffness, numbness, particularly under the arm from the lymph node removal, and buildup of the blood also will be more in the surgical site, like hematoma formations. So like this way, these are the basic strategies which we have been discussed till now. So we have discussed a few strategies which are being given as the initial strategies here. So with the pyramid point, with the ingredient of the question, strategic words, subject of the question, positive and negative inquiry. In the next video, I will be discussing from the use of ABC and all those strategies as a remaining strategies. So we will be discussing. So prepare well, do your exams well in your Prometric, DHA, HAAD, MOH, and even with the NCLEX also. So you can have a very good exposure with these videos. You may get experienced, you may get a proper knowledge also, you may get a proper preparations methods also through this way of videos. Please subscribe to my videos, to my channel, and you may get notified for each videos in a future. Bye.